Can I get a magnifying glass?
Oh, I have one! Here.
Thank you, Darla. If we zoom in even further on Mandy's elbow, we get a closer look at the varying aspects of a psoriasis lesion. Here we see the reddened areas of skin indicated by the red arrow. This white arrow is showing us the silvery white scales that overlie the red areas. This is a pretty typical symptom of psoriasis. Since there are no standard diagnostic tests or labs for psoriasis, if a patient presents with these clinical manifestations, psoriasis is suspected.
Then how do you know it's really psoriasis?
Always good questions, Darla. Because there is no diagnostic test, healthcare providers who suspect psoriasis will often further investigate the client's condition. They do this during their assessments of the client. First, they will inquire about family medical history to see if psoriasis runs in the family. Psoriasis is genetic, so it's likely that a relative will have this condition as well. They may also assess the patient's hands and fingers for signs of psoriatic arthritis that can be accompanied with advanced psoriasis. However, as aforementioned, the reddened scaly lesions are the primary indication of psoriasis, which is why a skin assessment is essential for the diagnosis during the early stages of treatment of a patient who may have psoriasis. The biggest indicator of psoriasis is known as Auspitz sign. Unlike any other skin condition, in psoriasis the lesion will bleed when the silver scale is peeled or picked off. The red itchy lesions indicative of psoriasis can be aggravated by varying factors, including environmental factors such as trauma or stress, or systemic factors involving infection, smoking, alcohol, or drugs.
So what do they do about it?
In regard to treatment, there are various options which include topical agents such as emollients or corticosteroids that rehydrate the skin to relieve itchiness, sunlight exposure, and saltwater baths. However, the primary treatment option are medications called immunomodulators.
Modulators?
Immunomodulators work by adjusting the autoimmune response we discussed earlier. These medications act on the body in a systemic manner. They inhibit inflammatory mediators, tumor necrosis factor alpha, and interleukins.
Wait, what now?
Basically, they decrease your immune response so your body can't attack itself.
Created using Powtoon.